Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
Let's see if our notifications are going to work. Good morning.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
All right. I did not see a notification on my Facebook, so we might be a little slow this morning. But I can start with some updates. So for those of you that heard the last few days, Jasmine, one of our little young donkeys, she's in the ICU at North Carolina State University right now. The update that I saw yesterday afternoon was that she was stable in the ICU. She's still on oxygen, still, I think, getting a nebulizer on all of the antibiotics still. I believe some of the viral testing came back clear, so they did see some bacteria in the cultures, so they're just waiting to see what exact bacteria grows. Oh, hello, Edward. Edward's joining me this morning. And so once they get the culture results back, hopefully today, they'll know exactly what type of bacteria they might be working with and might need to change her antibiotic protocol. But at least she is stable. She's not out of the woods yet, but she is stable and doing okay and very comfortable, which is great. So we will try to keep you all posted on little Jasmine Donkey. Another update. Yeah, this is Edward down here, by the way. Another update is any of you that have cats, or if you're thinking about getting cats in the future, the Cat Summit is completely free. We posted the link to sign up. It's on the website. Same as last time. It's free to attend, but we are using Zoom, so we need your email so we can send you the Zoom webinar links. If you can't attend live, still give us your email because you'll get a copy of all of the sessions at the end. Okay, I'm just going to do a live with Edward this morning. So I have Edward, the bird, Marvin, and Mila, the dog, in the back. So we got the whole zoo here today. But the one animal that I actually wanted to talk about today, I don't have here because we sent out that little 2-question survey and we got some great results. So of course, most people wanted to learn how to keep their dogs naturally healthy, which is what we focused on for many years. We've done a little bit of cats. Cats was second. And we're going to be doing more cat stuff like the Cat Summit. We've got quite a few blogs and things specifically for cats coming up. The third most popular species that you wanted more information on how to keep naturally healthy was actually humans. So that's good food for thought. And it makes sense because like in our household, the pets are living a much healthier lifestyle than we as the humans are. And I really need to get my act together when it comes to my own nutrition and health. So we're toying with the idea of maybe finding some good kind of integrative, holistic people in the human world. We've gotten some good suggestions, and maybe they could do some content for us so that way we can all, as we're keeping our pets naturally healthy, keep ourselves a little bit healthier as well, which is cool. And then the species I want to talk about today is actually horses. So We know that many of you have other pets. Someone put on there that they wanted to learn how to keep their frog naturally healthy, which I thought was absolutely amazing. I wish I knew anything about frogs, but I really don't. But if we find a frog person, we'll be sure to bring them on. But horses, we know a lot, quite a few of you have horses. We have horses. We have our whole life, and we know that there's a lot of crossover between a lot of you don't just have dogs, you have other animals as well. So originally we were going to kind of double down on just sticking with cats and dogs because that's what Dr. Judy has kind of devoted her career to and has the most expertise. But then I started working with this amazing integrative veterinarian. Her name is Dr. Joyce Harmon. And she does dogs as well, but she is really the guru when it comes to horses. And I believe she has her master's degree from the Chi Institute. And of course, she's a veterinarian. And so we had a meeting with her, and I've done a few consultations myself with my personal horse, and she pretty much saved his life. And so we had another call, and I said, you have so much valuable information in your head. I was like, even if you want to retire and you don't want to write books or create videos or anything, I was like, can I at least like record you on a Zoom call, you just talking and talking about vaccines and nutrition and things like this, because she is just such a wealth of information when it comes to the horses. And so I'm really, really hoping that she's going to create some content that we can use for us too. Along those lines with the horses, we have been using some naturally healthy supplements for our horses for years that we really like and have seen great success with. So we are going to add those to the website. So any of you that do have horses, feel free to check it out. And I think in the spring, we might be doing a naturally healthy horse summit. So we definitely going to do dogs, cats. We have a connection to a chicken veterinarian, actually. They're very hard to find because most people don't do veterinary medicine with chickens. And now we have Dr. Harmon and a few other connections with the horses. So we're really excited. It seems like the Naturally Healthy Pets brand is definitely going to grow into more pets. And it's not just going to be my mom and I producing some of these educational materials. We're kind of partnering up with some of these other veterinarians that are that know more than us in their little silos. And so they're going to be producing a lot more educational materials for us too, which is really awesome. I'm super excited. I told Dr. Joyce, I was like, even if you don't want to make money off of anything and you want to fully retire and relax, I was like, I selfishly really need your education when it comes to like my own horses. I was like, so can we please, I was like, I will come to your house and like record it and type everything up for you. I'm a big Dr. Joyce fangirl. So we're super excited about that. And so what I actually wanted to talk about today, those are all the updates, but Dr. Joyce, when I was talking to her last night, someone wanted us to take in 2 draft horses. And for those of you that don't know much about horses, draft horses are the really big, heavy horses that you see, pulling wagons or pulling a bunch of weight typically. You can ride them as well, but typically they're bred for pulling. So they're huge and they've got the big legs and they weigh thousands of pounds. And so there's 2 that have lymphedema in their back legs, which basically makes their legs swell so significantly they're basically 3 to 4 times the normal size. And so I asked Dr. Joyce, I said, we're moving to a bigger office. We're trying to find more help for our business. I have a 1-year-old, we have all these animals, we're really stretched super thin, but it seems like no one else is able to take on these horses because they have these severe medical issues. And so I was talking to her about it and to see if there was anything that we could do to help. And she introduced us to CO2 therapy, which we actually have not used and we have not heard much about before, but I wanted to bring up the website that she sent to me with all of you. And I'm very curious if anyone has used this therapy, please let me know because we have not. Let me see. So this brand is called the Airjector. Let me go back to their home screen. And so it's for the transdermal treatment of medical conditions, and it basically is transdermal, so through the skin, carbon dioxide therapy. And we haven't heard of this before. But when we were talking to Dr. Joyce about these horses that had, the huge swollen, fluid-filled legs, she said that she actually had seen great success using this device in this therapy. And so I spent last night digging into it because I was fascinated. And so let me go over here maybe to their FAQ. So basically, they use it for various medical conditions, but it looks like it's a lot for soft tissue injuries. So in this case, it's a disease, it's the lymphedema, but apparently you can also use it with trauma cases. And so it helps with developing new tissue, with circulation, oxygen levels in the tissue, and decreasing inflammation, which, of course, all of those are really wonderful things. It supposedly reduces inflammation and pain. It's an antioxidant, and it also can work in some cancer scenarios. It can decrease the survival of hypoxic cancer cells. So it says apparently just a single treatment may have some immediate effects, but they recommend basically doing it. I saw a few different protocols where they would do treatments like every day for the first 5 days, and then 3 times a week or something along those lines. It has to be through your veterinarian. So unfortunately, this isn't something that you could buy directly. However, we hadn't even heard of it. So I'm sure a lot of your veterinarians probably hadn't heard of it, but some of their before and after pictures are pretty amazing. Sorry, if you're squeamish, look away because these are kind of gory. But yeah, it looks like they've had some really awesome success. Like, so this was just an unrelated surgery. They were removing a cyst, and they didn't have enough basically skin and muscle to fully close the incision. And so they use this CO2 therapy to aid in healing. There's a lot of cases with horses, like I said, these big swollen legs. That's what we were talking about the use for. And those are kind of gory. Sorry, I'll skip to those for those of you that are squeamish. But it's really interesting. And so you have to, my understanding, and again, we just learned about this yesterday, so we're kind of going through this together. There's the little CO2 cartridge. So you have to, well, I guess you don't have to, but they recommend covering the area that you're treating. So they have these little bags that I guess you hook the little machine into, and you try to make it airtight so it's around the top and bottom to try to keep the CO2 in the area. And so they seem to have these covers for whatever area you're looking to treat. So they have mostly for legs, they have whole back ends. So this is what we were talking about for the horses. It looks like you put this plastic all over pretty much their whole leg if you're trying to treat the whole leg for the lymphedema. Seal it, and then you use this pharmaceutical grade carbon dioxide. So it's really cool. We had never heard of this. And so if anyone's ever used this, I would love to hear more about it. But definitely ask your veterinarian what they think about it, because it seems like a really wonderful natural option to aid in healing. Like I said, they also use it in cases of arthritis and kind of more inflammatory conditions as well. It's not just for acute wounds. Yeah, so tissue blood flow, oxygenation, reducing inflammation. So it's pretty cool. And so this one is called the air ejector, but it's pharmaceutical grade carbon dioxide. So this is in an FDA registered and approved medical gas facility. So it's the highest quality, non-invasive, painless, and easy to use. So it can be used in the hospital, barn, paddock, or pasture. It looks like most of the cases were dogs and horses. I don't know if you can use it on cats. Looks like those are the main. Yeah, so this is kind of similar. This is what the horses that we were asked if we could help with. This is kind of what their leg looks like. That's pretty remarkable. especially anyone that knows horses. Horses are very fragile creatures, especially when it comes to their legs. So, yeah, this treatment really, like I said, Dr. Joyce Harmon, who I trust implicitly when it comes to the horses, she said that she has actually used this herself and she's had great success. And so I'm super intrigued. I definitely want to learn more about it. And it looks like for some of the dogs, they've had great success too. If you're at a smaller hospital, I don't know I have no idea how expensive this is. So it could be like $20,000 machine or something. But it looks really, really awesome. So it says it's fairly inexpensive. I don't know what that means, but it's a non-invasive way to treat severe cases. Very effective to treat a large area. That's true because you have whatever area you have bagged, I guess is what it gets treated. And the patient tolerated treatment well. So not painful to administer, non-invasive, and seems to have really remarkable results. So it's pretty cool. And so I think for dogs, of course, arthritis and inflammation, but any type of post surgery. So like that one case where they couldn't completely close the wound, they were using this to try to help aid in the healing process. So I thought this was really interesting. Yeah, so when they use the CO2 treatments, it looks like on a horse. Skin graft wound healing. Oh, they use it for bone fractures too. That's interesting. Yeah, accelerating lesion healing, reducing inflammation, an appropriate adjunctive therapy for treating soft tissue, and ligament to accelerate healings and reduce inflammation. Pretty cool. So yeah, I just wanted to introduce all of you to that because I found it absolutely fascinating. Like I said, this is through your veterinarian, so unfortunately, it's not something that you can buy. Someone was asking, how does this compare to ozone therapy? I don't actually know. Like I said, I really don't know much about this. Dr. Joyce mentioned it late last night, and bless her for answering my questions about these crazy medical cases from rescue horses at like 10 o'clock at night. She's a saint, but yeah, putting it on a cat would not go well. Yeah, probably. I don't think that would go well. Mila would be fine. Mila's like the best patient on planet Earth. She will do absolutely anything. Yeah, I will. Let me post the link to the site. Actually, I'll do it on my phone. It's airjectorvet.com. And I don't know if this is really applicable for anything that any of you are going through with your own pets, but it's definitely worth at least knowing about in the future if you have, a dog or I guess a cat. I didn't see any pictures of cats, but a dog or a horse that has a wound or inflammation or anything like that. It seems like it's a pretty cool new technology. So that's it for me this morning. Just gave you guys some updates, and we'll learn more about CO2 therapy together. If I learn more, I'll come back on and talk more about it. I did, as another update, I did get 2 of our 3 NutriScan redos back. And so Mila, who's right there, came back with pretty much no allergies. I think there was like 1 or 2 thing that I think it was like potato, maybe that she can't have. And Panda retested. I think she came back. She was still allergic to almost all of the proteins except for, I think there was one, I think lamb and beef, I think and maybe duck. So it opened up a little bit more for Panda when we retested her after washing her mouth out. So we have 1 more NutriScan out, and it's actually a dog that is on a hydrolyzed protein diet right now because the veterinarian said that it is supposedly allergic to every single meat protein. So I'm very excited to get that one back, and then we'll kind of review that together and see what the results are. If you have horses, we will be updating our website today with a horse category, and hopefully in the spring we will have Dr. Joyce Harmon producing lots of content, so that way we can all learn together from her amazingness. Here we go. Oh, everything but lamb and pork. Oh, let me. So to pause the music, some of you tuned in late were asking about Jasmine. The only update I have as of last night was that she's still stable, she's still comfortable. I believe none of the viral tests came back with anything yet. There was bacteria seen in the culture that they did of her throat, but it hasn't finished growing, so they don't know exactly what bacteria they're working with. So I think today they're gonna have the culture results, and they may tweak some of the medication she's on, because she's on those 3 antibiotics right now. So she is stable. She ate a little bit. She's doing a little bit better. She's not out of the woods, but she is improving slightly. So that is very good, and she's nice and comfy. They're taking good care of her. All right, hope everyone has a good day.